The first recorded case of COVID-19 in Southampton was in March 2020, but we were aware before then of the challenge locally and nationally with COVID-19. So we prepared. Being a port city, it was important that our ports had strong risk assessment in place, and our universities, because we had students travelling back from areas of China that had been infected. Our first response in March 2020 was in relation to reviewing our plans, making sure that we were prepared to respond and that we had all the partners engaged on those plans, and we knew roughly what the numbers would look like and how we could ensure we had the capacity to support people. So hospital beds, whether further facilities were required, but also thinking about the communications to the public. So we were just beginning to learn at that point what we could and couldn't do in order to reduce our risk. But it was very much a learning process over time in terms of people's behaviours changing. We were beginning to talk about ways in which we could increase space between people particularly. It's been a massive impact on our community, and very sadly, a large number of deaths, as we've seen in many other places, and equally a large number of hospitalisations, people requiring a lot more support as a result. It's had an impact on our health and care workforce as well, and many of the people that are resident in the city work within the health and care workforce and are incredibly tired now and worked incredibly hard on the front line for a long period of time to support people within the city. So it's had a big impact, particularly on the most vulnerable. We were aware from our GPs in the city the number of clinically vulnerable people and where they lived across the city, and we worked with them to understand what their needs might be in order to ensure that they could shield at that time from the infection. And so the council set up a hub to help with food and also medicines to make sure it was distributed to those individuals, and equally could be used if people needed to isolate and then moving on into lockdowns where people had to stay at home. So that became essential. And from that work, we've worked with the voluntary sector organisations to then link it in to all the other support services that are available and community provided schemes to help people. So a lot of work was undertaken early on, which has developed over the year to better support people. So, as we know, as we moved into the autumn, September, October, November, we saw quite a staggering increase in cases. So that was the second wave that hit us through the winter. So it hit us hardest during that time. And I think it was a real sense of hope for us as we moved into the new year when we saw the vaccine being rolled out and the impact that that's had. So we're working in the council with our partners in the NHS to look at how we roll out that vaccination programme in Southampton given our demographics. So can we pace it a little bit faster with that younger population when we get to that point? And equally, because we have high health inequalities in the city, and we know there are some pockets within the city, areas where we've seen higher infection rates over time and equally lower vaccination uptake rates for those groups that have already been vaccinated, we've set up pilot schemes within the mosque, within other areas. We're looking at other ways we can innovatively support people to get vaccinated. We've also worked very closely with our communications colleagues and with community engagement colleagues to make sure that people have access to the latest information on vaccines. And we know that, again, has been changing over time, and we still await the data from the trials on the use of the vaccine for children up to the age of 18, young people. So it's important that we clarify the facts in pregnancy for certain groups, for certain challenges, as well as get the latest information to those people and make sure we reduce the risk of misinformation. The reopening of businesses is so important to our economy, to our residents, to commuters coming in and out of the city, workplace well-being overall, and for making sure that people are in a financial situation that's sustainable. So as the situation eases, as businesses open up, it's very much about balancing the safety of individuals with getting people back to a degree of normality in relation to the way that they work and support others. So my top priority as Director of Public Health is responding to this threat that is the greatest public health threat that we've had in this nation, globally, in over a century. So responding to it is key, making sure that people are as safe as possible is key, but at the same time, given that we've been dealing with this for so long, it's balancing that with the impact that COVID has had on the economy, on people's finances, their lifestyles, children's education, the importance of people connecting as much as possible. So we've got considerable challenges in the city in terms of health and well-being. And what COVID has done it's put a spotlight on those challenges and those differences, that some communities are doing relatively well, others much less so because they don't have the resources to help them. So going forwards, it's using that knowledge, that understanding, and what has worked well during this time to better reduce those health inequalities. For instance, we know that our community work, our community engagement work, the COVID Champions scheme has been incredibly successful. So can we use that to develop great new ways for working within communities and community engagement work to help communities have stronger health and well-being?